In this video, I will be discussing about sleep apnea. Now, what is sleep apnea and what are the causes and symptoms of sleep apnea? Sleep apnea is a sleep-related breathing disorder. This means that while sleeping, one's breathing stops and again it starts in a fraction of a second, or it may last for few seconds to recover. In this problem, there is a decrease or complete halt in airflow while breathing. This causes sudden arousal from the sleep, which restores the breathing process. In sleep apnea, an individual may snore loudly. There are three types of sleep apnea. It may be mild, moderate, and severe. While sleeping, sleep apnea may affect your breathing cycle, but your brain helps you by arousing you and again restoring your breath. But sleep apnea certainly prevents you from restful and healthy sleep. If sleep apnea persists, this condition may create serious complications for you. The supply of oxygen also breaks while there is a break in breathing cycle. The lack of oxygen activates survival reflex that wakes you again to resume breathing and to keep you alive. But your sleep cycle is broken, preventing your restful sleep. This at times can put stress on your heart that may be life-threatening if not treated. For your knowledge, about 1 billion people between the age group of 30 to 70 suffer from sleep apnea. In nighttime, in the problems of sleep apnea, the symptoms may be pauses in breathing, may be unusual breathing patterns, frequent wake-ups, and snoring. There may be feeling of restlessness while sleeping, and you may sweat in the night. In the daytime, sleep apnea symptoms may include headaches. You may suffer from sexual dysfunction, and there may be fluctuation in your mood. You may feel shortness of breath. You suffer from fatigue in daytime. You may feel exhausted and sleepiness. The factors that cause sleep apnea may be biological, family history of sleep apnea, heart conditions, a stroke, or elevated blood pressure can be the reason for sleep apnea. Large tonsils and obesity may also be responsible for it. If not treated in time, sleep apnea may result in several complications. These may include excessive daytime sleepiness. You may fall asleep for a brief period of time during the day. This may be dangerous while you are operating some machine or when you are driving a vehicle. You may suffer from high blood pressure. Your heart may damage and may result in heart failure. You may suffer from arrhythmics. Sudden cardiac death can also occur. The organs which sleep apnea affects may be numerous, but the most affected organs are circulatory system that involves heart and the nervous system that involves brain. To get rid of obstructive sleep apnea, you will have to change your lifestyle. For example, you will have to reduce your weight as body weight can increase the risk of sleep apnea. The excess fat in or around the neck can create problem in person's breathing. One should avoid smoking, should refrain from drinking alcohol, should refrain from intake of processed and fast foods, should exercise regularly for at least 45 minutes daily, should include breathing exercises like Laghu Shwasi Pranayam, Anulom Vilom, Kapalbhati, and Bhastrika Pranayam, should avoid sugary beverages. One should avoid sleeping on their back. They should sleep on their sides to avoid sleep apnea attack. If this problem persists and medication fail in treating this condition, then CPAP machine, that is continuous positive airway pressure machine, a breathing device can be used. Neuromuscular electrical stimulation, NMES, can also be used. It is a device that prevents the tongue and upper airway muscles from blocking your airway during sleep. Jaw surgery and nasal surgery may also be suggested by your health provider, but prevention is always better than cure. To prevent and reduce the risk of sleep apnea, one should maintain an ideal weight. One should eat nutritious food and exercise regularly, should practice good sleep hygiene, should take care of Such health conditions as high cholesterol level, high blood pressure, and type 2 diabetes. There can be emergency if there is a pain in your chest or shortness of breath or sudden weakness or numbness on one side of your body. Vision may also be affected and you may feel difficulty in walking or may feel dizziness. Symptoms of sleep apnea: fluctuation in oxygen levels, increase in pulse rate, chronic elevation of blood pressure, especially in the daytime, impairment of glucose intolerance and insulin resistance, irritability, morning headache. When you wake up in the morning, your mouth is dry. This is Bright Lifestyle. Thank you for joining.